Alright, and here we are with the PowerPoint presentation of the respiratory system. First things first, if you're serious about learning these anatomical locations of the human body, you must constantly practice and practice. I cannot stress that enough, everybody. Second, in order to perfect your knowledge on this, you must repetitively pronounce and write down the anatomical names. This will not only help you turn this information into long-term memory, it will also help you learn the names much faster. For example, just get a piece of paper, get a pen or pencil, and just start writing them down multiple times. This will help so much. Lastly, this is only a PowerPoint presentation video, guys. This will only help you so much. This should not replace having the actual anatomical models in front of you. Having the models in front of you is 10 times better and will help you out so much more. But since this is all you have right now, this is going to have to be sufficient. Alright, so let's get started on the first part of the respiratory system, which is going to include our face. So we're going to start off by going with threes with this. Sometimes we'll do twos, sometimes we'll do threes, sometimes we'll do more, depending on the names and how easy they are. The first three we have here are conchae. These act as little filters and humidifiers in our nasal cavity. So here we have our superior nasal conchae, which is just superior means above, middle nasal conchae, and then our inferior nasal conchae, which just means below. Alright, next set of three, we're going to start off with our hard palate, which is above our mouth, and then when we go further inside the mouth, we have 5, our soft palate, and then at the very end, which we all see all the time, is our uvula. Alright, we're going to go down here to 7 where our glands are, and we're going to have our sublingual gland, that's going to be under our tongue, and then we'll have 8, which is going to be submandibular gland, and then 9 we'll have our epiglottis. And two things about the epiglottis. One, the epiglottis will prevent food and water from getting down into the airway, but also if someone was born without an epiglottis or had it surgically removed for any reason, that's okay. Our vocal folds act as a secondary barrier and can actually help prevent food and water from getting down there as well. So if anything happens to where your epiglottis is removed, don't worry, you have a second barrier to help keep food and water out. And speaking of, we have 10, our ventricular folds, which also help a little bit as well, but it's mostly 11, our vocal folds. And then we have our cartilage on the side of our airways, which is going to be 12, which is going to be the thyroid cartilage. And that actually protects the front of our airway, which is good because traumatic injury can happen there very easily. Alright, and here we have 13, which is going to be our internal nares, and then 14, which is going to be our opening of an eustachian tube, and that's where mucus is going to come out. And then 15, we're going to have our nasopharynx, and that's just telling you the location, which is here. 16, which is going to be one of our tonsils, which is going to be our pharyngeal tonsils. Then we have 17, which is going to be our palatine tonsils. And then 18, which is going to be our oral pharynx, and that's going to be, again, this area right here. And we have 19, which is going to be our fauces. And then 20, which is going to be our laryngeal pharynx, and that's going to be describing this area right here. And now 21, the last part, which is going to be another part of our cartilage in our throat that helps protect our airway, which is going to be the cricoid cartilage. Alright, next slide here we have our epiglottal cartilage here up top, and again the epiglottal cartilage is going to help prevent food and water from getting down into the airway, which is very important. But again, without it you can use the vocal folds, which we'll see here in a second. But for number 2 we have our hyoid bone, which is very important, helps keep the airway nice and open, very protective. 3, yep, our thyroid cartilage, which is a little more prominent in men, as you can see in the Adam's apple, but for women obviously you don't see that. 4, you have our cricoid cartilage. Then 5, you have our C rings of the tracheal cartilage. And then 6, you have your vocal folds. And again, if you didn't have the epiglottal cartilage, then your vocal folds will help out as well. And then 7, you have our corniculate cartilage. And then 8, which will be our arytenoid cartilage. And these will help open and flex open and close the vocal folds in order to change the tone of our voice. Alright, so this one's a little oddly numbered, but that's okay. We'll just go in order as best we can. So 1, we have our thyroid cartilage, which we went over, and then 2, it's going to be our cricard cartilage, and then 3, which is going to be our new one, which is going to be our apex of our lung. And that's just like on a triangle. You have the base, which is the bottom, and then you have the top, which is the apex, and that represents the very top of the triangle, or our lung, the apex of the lung. 4, for actually 4 and 5, guys, it's going to be a little backwards, because 4, you see the red, that's actually going to be our pulmonary vein, not pulmonary artery, because 5 will be our pulmonary artery in the blue. Because remember, it's backwards when it comes to the lungs, because the heart is now sending deoxygenated blood to the lungs via the pulmonary arteries, because arteries are going away from the heart and veins are going to the heart. And the reason the pulmonary arteries are blue is because you have deoxygenated blood in there at that time, or less oxygenated, to be perfectly honest. And then the pulmonary veins will bring blood back to the heart, which will have oxygenated blood. 6, down here we have our bronchioles, which will be one of our last stop into the alveoli, and we'll go over those in a little bit. And then 7, we'll have our pulmonary lobule. Then we'll move up here to 8, which again, it's a little oddly numbered, so we're gonna go a little out of order here, but that's okay. So 8 will have our secondary bronchi, and then 9 will have our trachea, and then way up top we'll have our hyoid bone again. And then we'll move down all the way to 11, and now we're going to get into the left and right side of the primary bronchi. So here we have the left primary bronchus, and we have our right primary bronchus. And you'll notice that the secondary bronchi say bronchi instead of bronchus. That's because we're labeling 2. Bronchi means multiple, bronchus is singular. Alright, for the next slide, don't worry, we won't be labeling every single one of these lines, just the ones that are numbered. So 1, we start off again with our primary bronchi, and then 2, we have our secondary bronchi, and then 3, we get down smaller here, so you can see where we have our trachea, and then it breaks down smaller into our primary bronchus, and then our secondary bronchus, and then it's going to break down again, and that's going to be our tertiary bronchi right here. And then it's going to break down one more time, which you can actually see right here in multiple spaces. That's going to be bronchioles. And now we get back to the vessels that are delivering deoxygenated blood to the lungs, which is going to be our pulmonary arteries. Again, remember that's coming out of the heart. That's why they're arteries, but they're labeled as blue because they have the deoxygenated blood. And then 6, pulmonary vein, which is going to be returning to the heart with oxygenated blood in order to deliver it to the rest of the body. And we get down here at 7, which is not really important to our respiratory system, but it does run right behind our trachea and behind our heart, which is going to be our esophagus. And then 8, which is actually very important, which is going to be this whole area, is going to be our diaphragm. And this diaphragm is going to help inflate and deflate the lungs because they can't do it on their own. They need this specific muscle in order to do that. So now let's move on to the next slide, which again, we're going to start off with our tertiary bronchi. And then we'll move on to 2, which is going to be our bronchioles. And then 3, we can see, oh, there it is right there. It's going to be our pulmonary veins. And that's going to be taking reoxygenated blood back to the capillaries, into the pulmonary veins, and back to the heart. And then 4, we have our alveoli. And again, you can see the I again at the end of the alveoli because we're pointing at multiple. If we were just saying singular, if we were saying just this one right here, we would say alveolus. And on our next one, we have our pulmonary arteries. And then 6, we have our capillaries here, which we can see running all over these alveoli. And then we have 11 here, which is our visceral pleura. And all the visceral pleura is going to do is keep our lungs from rubbing against the chest cavity wall, because they would wear down if they didn't have that protective layer. Alright, now we move down into a microscopic view model of our alveoli, which is both of these, or alveolus, which is singular, this one. Alveolus, there you go. And then we have in between every single one of these, as you can see here, is going to be our alveolar capillaries. And this is, guys, where oxygen will fill this chamber and it will diffuse across through one of these crevices here. You can see these little crevices here, and they'll diffuse across into the blood vessel, which there'll also be a crevice in here in the capillaries that would be very loosely fit, so where oxygen can fit through, and also CO2 will diffuse across back into here as well, and then be exhaled out through the mouth. And then 3, it actually shows you the little parts, which is going to be our alveolar epithelial cells. And here again we have our alveolar capillaries, and then 2, a new one for you guys, that's going to be our elastic fibers, and those are going to help collapse and expand the alveoli, especially when we're not using some of them. And then here is a little half view of our alveolus. Alright, and that's going to be it for the respiratory system of the PowerPoint presentation, guys. So I hope this helped you guys out a lot, and good luck!